And following my statistical colleagues, I'm a little humbled here. I'd like to thank you for the opportunity to talk today. So I am the president and CEO of Chimerix. We are a publicly traded biotechnology company. I am a shareholder. I am also on the board of the emerging companies section of the Biotechnology Industry Organization, which represents literally hundreds, if not a couple of thousand, small emerging biotechnology companies, as well as some of the large pharma. But the ECS, emerging companies section, is the smaller pre-revenue companies. My comments today are not on behalf of Bio, because Bio and the ECS are still working through their position on the very difficult issues that are being discussed today. I think you can look at the comments as representing my personal comments as well as those of many of my colleagues who are fellow CEOs in the biotechnology business. Not to spend any time on Chimerix in terms of the specifics here, but rather, as opposed to thinking about us as being atypical, please think about us as being prototypical. This is a 12-year-old company founded in the early 2000s to develop a specific compound called brincidofovir. That compound just recently entered phase 3. The phase 2 data were published in the New England Journal in September, so it's an interesting trial. It's an interesting company. We have one lead compound, another license to a large pharma company, and then a pipeline. This is not unusual for a biotechnology company. This is my fourth. My first took 15 years to market. My second, as you'll hear about, lasted 20 years before it completely failed. We have about 55 people in the company. We are obviously trying very hard to develop a new product to change medical care. There are a couple of things on this company and how to think about a biotechnology company. The first comment usually generates some smiles and laughs, but I'd like you to keep this in your mind. A biotechnology company is a research and development pipeline without revenue. It is a very important component of the way to think about these entities, because as you talk about the resources necessary for the things that you're thinking about, they're drawing potential resources from our efforts in developing new drugs. Think about a biotechnology company as a standalone boutique. You can think about a pharmaceutical company as a department store. Why is that relevant? A department store has lots of different components to it. You got perfume on the first floor and glassware on the third floor, and you make it up on Ralph Lauren and Versace. You've got revenue-generating compounds, revenue-generating products in your department store. A biotechnology company stands by itself and lives or dies on that particular product. And believe me, I've been through that a bunch of times, and so have all my colleagues. So that differentiation, the pre-revenue, unencumbered by revenue model, is something very much to think about. As I listen to many of your comments today, I am concerned that that's not being taken into consideration, because I think that you can think about biotechnology companies as increasingly being the lifeblood of new pharmaceutical development, and I think you run the risk of badly influencing that by some of the things you've talked about or some of the things that might happen with what seems to be a very good idea badly implemented. So we are in an intense investment stage for this company. So far at Chimerix, we were venture capital backed. We went public last year. We've raised over $300 million through our various endeavors. I can't begin to tell you how many hundreds of millions of dollars will be necessary before we have profit, but I can tell you it is hundreds of millions of dollars. I don't manage a P&L, I manage an L. And I think you need to think about that. Again, I'm trying to be a little humorous, but I'm trying to implant in your mind the complexities of this business. We are formed and we survive by people making a decision to invest in these companies. And anything that is done that takes away from the investment pathway by allocating resources to a different area decreases the return, increases the risk, decreases the probability of investment, decreases the likelihood we will exist. I know that's a tough equation, and it sounds a little dramatic, but I think you need to consider it because it has a lot of economic reality to it. So, at the highest level, we as an industry have every desire to be open and transparent in our research activities and in our data. But we also need to recognize that we do not live in a world of perfect actions, of perfect people, of perfect outcomes, of perfect analyses, and that there are many people who might do things for reasons other than perfection or good. And if those things happen with all the good things you've talked about, it could permanently and dramatically impact this industry. So Here's Chimerix, and this is again prototypical. The dollars invested outside of this core set of functions would need a very high justification because we're drawing away from our research and development activities. Small biotechs do not yet have revenue and profitability, and any funds and resources diverted are diverted from a core mission, and that must be very carefully considered. I think it's difficult to talk about this, and I don't know how much you've talked about it over the last 2 days, but this is an issue of economics and investment, and it's kind of a third rail for some of these discussions, but it has to be considered. It just simply cannot be ignored. You can't fund a company by giving credit to people. Credit doesn't have any economic value in the environment of starting and forming and building companies. It has to be something, it may be a wonderful idea for an academic researcher to move ahead with analyzing data, but that doesn't have any impact on the company. That's not the reason for doing this. It has to be from the betterment of society, but you have to trade off when you take money from research, what are you gaining that's a benefit? I think that really is an underlying and important issue. Understanding what's required, this is more than just a data spreadsheet. I heard Dr. Rosenblatt made the comment that from his perspective, it's 3 to 5 people and several $1 million of resources to handle these efforts. For me, that's 10% of my budget. So the resource allocation issue is really important. Clinical trials are massive data sets. The responsibility for sharing them is much more complicated than a simple spreadsheet. When you talk about, well, maybe a year afterwards you should publish. If we have good phase 3 data in 2015, when it's anticipated, the first 6 months or more will be spent by a massive effort to analyze that data to prepare an NDA filing. And once that's done, the next X number of months will be spent in a massive effort to interact with the FDA to prepare for the hopeful approval and interaction, perhaps an advisory committee. And after that's done, the efforts will be focused on preparing the market or getting it to market. Think about the resource allocation for a pre-revenue company. And after that's done, by the way, because one trial does not make a product, we have to run many more clinical trials to expand this compound. And again, all of that requires resources. So data release and public data for data's sake doesn't work in this model, as important as it might be. And I'll come at the end of this presentation to areas that we think it can be, or I think it can be, not we. But I think that even if it can advance public health, it must be weighed against the other implicit and explicit costs. All right. So that's the question of the initial opportunity cost and the issues to think about. There are many unintended consequences from the actions that could be taken here. Slowing down essential therapies getting to market, because if you take out resources and put them somewhere else, you're taking them away for research and development. There's a resource burden from data sharing that needs to be considered, a resource allocation. This issue decides how we're going to allocate space in our department store. If you're a large company, they already have revenue, that might work. For a small company, it's whether or not we buy a new product to put on our shelves or we have a lawyer do some work for us. That's the boutique model. We have to allocate resources differently, and you need to think about that. So the idea of this slide is to reinforce the concept that, that investment outside of basic R&D functions comes at the expense of the functions. What's the scientific merit and public health potential of the request versus an investment in research? What are the research participants' considerations we've talked about? But how do you balance those benefits against the ability to assure a company can succeed? So there are stark complexities of biotech survival. We may not have time today, but I was the CEO of a company called Allocation. We were one of the smallest accelerated filers in the United States when they implemented Sarbanes-Oxley in 2003. It was a wonderful idea. Some people did some bad things in large companies. Let's have everybody double audit all their financials. So for 10 years, until I had the Jobs Act, you talk about this funding dearth and the lack of availability of capital. There was a dearth of capital in biotech, and people were talking about the end of the industry. They put the Jobs Act into effect. We were able to find a window. Chimerix was one of the first companies to go public. There's a lot of money being raised again. But again, now you're talking about resource allocation. So the unintended consequences of SOX were that I was allocating R&D money to accountants. And by the way, it was about 10% of my R&D budget in a company that had been crippled by a phase 3 failure. And the reason we were one of the smallest companies, we had a phase 2 failure. We were at $250 million market cap on June 30th and a $50 million market cap 3 weeks later when a phase 2 drug failed. So these unintended consequences must be considered. One of the other unintended consequences I heard was, gee, large companies might signal to each other. I want to make you aware of a concern that I have that I haven't really had a chance to discuss. So we put out data, and we have no resources to analyze it. But large companies do. So now we put out data about some clinical trial. We don't really know what it all means, but somebody else gets a hold of it, and they figure out what it means. And now we've given an advantage to somebody who has 50 people who can analyze our data, a staff that can look at it and figure out what that does. And so we've taken our advantage in an area of science and given it to somebody else. So another unintended consequence that you must consider. You know, the life cycle of drug development, there's another comment about open sourcing. It's a lovely idea, but the life cycle in technology companies, where they have, by the way, copyright protection among other things, is very different than a 15-year to market, if you're lucky, 90% probability of failure industry, where you have to raise hundreds of millions of dollars to succeed. It's a lovely concept to say open sourcing is great. I think it has to be thought through. I won't say it won't work. I don't know what will work or won't work in this industry. I just want to caution you that if you don't think about it, you're going to fall off a cliff. So the final thought to think about is, I have been the CEO of a company that ended at the end of the day with nothing being done. I would have loved to have given that data in overt nephropathy and cardiovascular aging to somebody who could have analyzed it. So there are a lot of avenues, placebo data from clinical trials, data from things that have failed. I think the comment was, trial abandonment was the comment that you made. I like that terminology. This was an abandoned set of clinical trials, $250 million worth of work done. There are things that can be done that are, if you will, risk-free to damaging an industry and can be very helpful that should be thought about. We talked a little bit with the lawyers before, the issue of if you're closing down a company, you can't have any open liability. So you'd have to find a way to have this go to somebody else and nobody ever looks back. And if you come up with ideas like that, you can really build some interesting data to be shared. But again, I think I pointed out the cautions and the risks. I'll stop now and be glad to take any questions as we get to them.